problems to treat is intra-dog aggression in the same household. There are lots of reasons for that, but the primary ones are there is injury happening, not just to the dogs, but often to the pet parents that are reaching in to break up those dog fights. Another big challenge is that there's more than one dog with a behavior problem. It's hard enough to treat one pet who has a behavior problem, but now you have two. I have the essentials that you will need to help pet parents help their dogs to get along better. By now, most veterinarians are aware of the spectrum of care. The spectrum of care basically uses evidence-based medicine to offer to clients all the options for treatment for their pet with consideration of the entire family. It's family and pet centric. When families bring two dogs to you that are fighting with each other, you're going to offer that same spectrum of care. So the first bit is rehoming. Look, I don't like to talk about that, and it feels uncomfortable to even bring it up to people, but I have to because often there is a family member who can take one of the dogs so that the fights are completely avoidable. The second option is going to be crate, gate, and separate for life. So live with both of those dogs in the same household, completely separate. Again, this feels inconvenient, but sometimes it is the best option, and it's definitely the least expensive option. Another option is to crate, gate, separate, and medicate, because some dogs cannot live separately without feeling significant stress, because both dogs don't necessarily want to be with each other, but they do want to be with the family. So sometimes you need a medication to implement that second level of the spectrum of care. The third level of care is offering a plan that will end in partial reintroduction. So partial reintroduction means the dogs will all be monitored when they're together. They will always be on leashes. There will always be some type of safety net in place. That usually takes at least 2 to 3 months of working with a dog training professional, and it takes medication usually for both animals. Then the fourth level of care, which isn't necessarily better, it's just different, would be to work with the dogs for 6 months, maybe a year, with a qualified positive reinforcement dog trainer and medication. And the goal here is for full reintegration, but let's be realistic. The relapse rate is very high with these kinds of cases, and so full integration doesn't mean that the dogs can be left alone together and just forgotten. Clients like to know numbers, so you can tell them that about 69% of the cases that are treated all the way through with proper treatment, medications, behavior modification, etc., end up resolving to the pet parent satisfaction. That does not mean they're able to be together unsupervised. That does not mean that life went back to normal. It means that the pet parent ended up being satisfied. There's 6 key takeaways that you should know if you are presented with two dogs fighting. Number 1, if they're getting all the way to you, they are not going to work this out on their own. They need treatment. Number 2, it's a mistake to let the dogs fight it out and see what happens. That is a recipe for disaster and a trip to the ER. Number 3, pet parents often come in flummoxed. The fights were very infrequent and now they're happening every day. Normalize that for them. This is exactly what usually happens. Infrequent fights become more frequent when the problems aren't treated. Number 4, if the dogs are at the point where they're hurting each other, both dogs need to be treated. That means a behavior evaluation, a workup for pain and systemic disease, and also probably medication for both pets. Number 5, no matter what the pet parent says, 99% of the time, both dogs are involved. Even if one dog is the primary aggressor, there's usually a dog who is instigating or causing that aggressive dog to be more anxious, inciting the aggression. Number 6, always work up both dogs completely. You just never know what's going on. One of the first things that you do to treat dogs who are fighting with each other is avoid situations where they fight. So it's helpful to know when dogs fight. 73% of dogs fight over stuff. So that's food, toys, beds. About a quarter to a half of dogs fight over pet parent attention. A little over a third of dogs fight when they're overstimulated. That's at the window, barking at something, or when the pet parent first comes home. About 18% of dogs fight in tight spaces, and the times when I see that the most is like a coffee table where dogs are trapped, or hallways. That's a really common one. Coming into a sliding glass door that's only partially open, that's another tight space. Dogs fight because life is stressful. If you have a dog who has noise phobia, for example, and he's more stressed during that time, he's more likely to engage in a dog fight. Dogs fight because they're sick. This is super common. That's why we always want to work up dogs that have any behavior problem. And about 13% of dogs fight for, we don't know why. Sometimes, unfortunately, we can't always parse out what the reason is for the dog fights. But the good news is that the treatments that are applied can help regardless of the underlying cause. At the end of the day, when a pet parent brings her dogs to you that are fighting, your first step is always to work them up for pain and systemic disease. Treat everything that you can find. And while you're waiting on your lab work to come back or waiting to schedule another day for x-rays or whatever, keep the animals separated. Crate, gate, separate. Board one of the dogs at your hospital. If there's a trusted daycare, send one of the dogs to daycare. Send it to a friend's house. Just stop the fighting. This does several things. Number one, the fighting stops. But number two, it gives the family a moment to feel what it feels like to not live in chaos, because it's very hard to make good decisions about your pet's medical or behavioral care if you are completely stressed, right? So let's separate. If you need to use medications to do that, then go ahead and do that. Then you're going to lower the stress of the dogs and present all those options that we talked about earlier to the pet parent. Let them decide what is best for their family. From there, it's straight ahead. You can refer to a veterinary behaviorist and they can lay out a behavior modification and treatment plan that is right for that family. There are definitely things you can do to help dogs live peacefully in the same household.